So I want to spend a little time talking about the pathophysiology of Parkinson's disease as it relates to the autonomic nervous system or non-motor control. And this is just a quick drawing here to show you the spinal cord and the parasympathetic and sympathetic nervous systems. And I think what's most important here is to note, particularly here, this upper arrow. This is the cranial nerve 10, top here of the spinal cord. And just to notice all of the different organs in the body that are affected by this nerve. And they have found Lewy bodies right here. And so you have the heart that's affected, you have the stomach, the whole digestive tract that's affected. You also have the kidneys and the bladder affected. So there's a lot that can be affected once you have this, whatever it is that causes the neurons to die within the nervous system. And whether the, let's say, Lewy bodies or the alpha-synuclein or whatever it is coming from this way in or this way in, that's still a question that needs to be answered. So the primary systems affected, just about every system in the body is affected because this is the autonomic nervous system that we're talking about. And the primary pathophysiology of the nervous system here is that the nerves degenerate. And because the nerves degenerate, you're no longer getting the involuntary sort of synaptic activity going, and so there's a lot less involuntary muscle control. So this is primarily going to affect the smooth muscles in the body. So we've already talked about how the musculoskeletal system is affected. And again, that's more dealing with the central nervous system. So let's move to the gastrointestinal system, the digestive system. There's a lot that can go wrong here. There's a lot of smooth muscles that are associated with the digestive tract. Basically, what happens here is your parasympathetic nerves form the dorsal motor nucleus of the vagus nerve, which then descends into the GI tract. And what they found in people, again, with Parkinson's disease, is the vagus nerve contains alpha-synuclein. So what you see in people with Parkinson's disease, and again, these are some of the earlier symptoms that are nonspecific, is you might see drooling, you might see issues with swallowing. It's hard for them to swallow. And there may be issues with the stomach, delayed gastric emptying. And in the lower GI tract, constipation is really the big symptom. And again, highly nonspecific, but constipation does seem to be a really big issue with Parkinson's disease. And the reason for that is just the excitatory pathways are all messed up. And you have decreased colon transport, and you also have some issues with how the colon actually works with the rectum in terms of the pressures and how the muscles are working there. And so it's very difficult for people with Parkinson's disease to void properly. The other interesting they found just recently in the gastrointestinal system is there seems to be a difference in microflora in those with Parkinson's disease. So a bacteria called Prevotella seems to be particularly low in those with Parkinson's disease. They found actually about 80% less than those without Parkinson's disease. And so they're thinking this bacteria may have something to do with ghrelin secretion. Well, they know it has something to do with ghrelin secretion, but they also know that ghrelin increases motility and stimulates appetite. So there's something going on here, and of course, whether the microflora is a cause or an effect of Parkinson's disease is still to be determined. The cardiovascular system is affected. Dizziness is the most reported symptom, and this is caused by orthostatic hypotension. There's a fairly high occurrence of this. And basically what happens here is a normal person, when they experience a really quick drop in blood pressure, the blood vessels around the heart and the rest of the body will reflexively constrict to try to maintain the blood pressure. However, in folks with Parkinson's disease, this response is absent or just highly ineffective. And so it's quite normal for them to feel dizzy and to fall. They've also found alpha-synuclein in the dorsal motor nucleus of the vagus nerve and around areas of the heart and nerves of the epicardium. So again, all of these little traces of Parkinson's disease seem to be throughout the body. I want to bring up the integumentary system just because I think it's interesting, not a system that we talk about too much. But people with Parkinson's disease can either have excessive or decreased sweating. And sweating is, part of the way that the body regulates the body temperature. So it's a signal from the hypothalamus. And if the spinal cord has Parkinson's disease pathology, you're going to have issues with this cycle, this homeostasis cycle. And you also can have issues with the sweat glands and also the erector pili muscles. Those are the little muscles that attach to the hairs in the skin. And so either one or the other happens. Again, Parkinson's disease and the symptoms can vary a lot from person to person. The urinary system is affected. That was mentioned in the video that you saw earlier. But basically, there's just a lot of issues with control. And the bladder just seems to be overactive. So some of the nerves, or the nerves that seem to be able to, hold the volume in the bladder, just are no longer there. And finally, just a brief mention on sleep. Insomnia is a huge issue with Parkinson's patients. Also restless leg syndrome and REM sleep behavior disorder. And really, again, what has happened here is neurodegeneration of the neurons, particularly in the brain, that are associated with sleep-wake rhythms, and also the REM sleep. And so, the issues with sleep can cause a lot of other issues as well.